So now there's the easiest panel of all, the future. What are we going to do? What are we going to do next? And on this lucky panel, we have Jasmin Ellis, who's General Manager of Integrated and Community Health, and co-chair of Executive Management Team at Western Sydney Diabetes and the Western Sydney Local Health District. Anthony Newton, who is the newly minted CEO of WentWest. He's been there all of 4 weeks, and therefore he now knows everything. Professor Di O'Halloran, who is chair of WentWest, and tells me that she's cut back her workload by 50%, which means that she's only working 50% harder than everybody else at the moment. Glen Maberly, who is the founder here of Western Sydney Diabetes. Rowan Clifford, who's Group Executive Health Services Operations Diabetes Australia. Ozenc, who's Corporate Vice President and General Manager of Novo Nordisk Oceania. And last but not least, Morgan Stewart, who's CEO of Workers Lifestyle Group here in the building that's hosting us. So thank you very much, Morgan, for hosting us and the commitment here. I want to start local, like I have with the others. What's the way forward? I mean, your business is understanding the community, being part of it, moving forward and making things better than they are. And that's what the clubs like this are about. Talk to me about the future and your vision.
Well, ours is actually an interesting journey, and to quote Glen, we've joined a revolution, not started one. We've been world famous in Blacktown for nearly 70 years, 55,000 members, and proudly partnering and trying to make effective change locally where we can. Our board of directors, and I shout out to Murray Searle, who's in the room tonight, and also our president Jack Miller and other board members. Strategically, our board's job is to provide us a direction and a sense of where things are going, and diabetes has been on people's radars for quite some time. We started things, and we don't like to just do the big check and then take a high five and move on to the next thing. We'd like to make commitments where we can. So we started a 5-year commitment to try and combat domestic and family violence, and we're in our 4th year of that, but we're in our 2nd year of challenging diabetes locally where we can. So our job as a member and community-based business is to try and provide a megaphone on this scourge. It's a scourge like family and domestic violence. This is a scourge too. So our job is to try and maintain a commentary and a megaphone and try and make and measure change where we can. So we proudly started attending events.
The 2 kilogram challenge?
Yeah, the 2 kilo challenge is definitely part of that, and Steve Barley has been very vocal in getting that up and running, and I think that I'm about to make friends in the first ever walking group, I suspect, very shortly after this meeting, which will be awesome. As long as it finishes and has perhaps a cap with 2 cups of coffee and a straw, I'll be okay.
But only in your favourite coffee shop.
Absolutely. So for us, it's about...
Do you know who your GP is, by the way?
Say again?
Do you know who your GP is?
I should do. She's a wonderful lady up in the Hills Precinct. Kimari Obesikura, her name is. Wonderful Sri Lankan woman who is trapped in time, and she's been my doctor for 15 years, and she has not changed one single piece in 15 years, and may still be perched on the same chair that she's been sitting on all this time. But setting that aside, our job is to maintain focus, we think. So we've started a journey around food, around community, around megaphoning access, and asking people to be part of a journey, to come in and have blood sugar taken, to spend time with Victoria and talk about food, to spend time with Janine and talk about line dancing, which I will never in 2 lifetimes participate in, but I accept that it happens. And I'll just graciously move through to the next thing. But for us, it's...
Yeah, diabetes is looking quite attractive, actually.
It's hideously... nobody wants to see me line dancing for any reason. But what we are is committed on a journey, a 5-year journey. We're in the 2nd year. This problem is not going away, and neither are we. So what we're trying to do is just be good community partners and speak as often and as loudly as we can on this subject, and try and encourage people to participate in testing. They're trying to get benchmarkable data so we can start. I'm a data nerd too, I like the data. And certainly that's where we're partnered with people like Noel Duncan from Sisu about having the machines in our clubs. We took that advice from Priceline, the sisterhood, who are great advocates in this space for testing. So we are trying to adopt a 2 ears, 1 mouth proposition, I guess, where we listen to good ideas and then try and advocate and then we're not afraid to have a go, and if it works, it does. If it doesn't, that's okay. We just move on to the next thing. But we're trying to keep a forward focus on this problem that's not going away.
And Jasmin, from the local, the idea of the future from the local system level.
Yeah, thank you. I think might work. It's just me. We keep not use error. We keep going, Norman, is the answer to the future. And we remind everyone that it's not a health problem. Unfortunately, the pointy end sits with us in Western Sydney Local Health District, but certainly it's alliances like this is where we actually get the power to make the change. We know that the health budget, as great as it is and big as it is, doesn't support initiatives like this because activity-based funding doesn't recognise initiatives like trying to sort out primary prevention. We've got a great health promotion team as well, Aboriginal Health Hub. We have to look for other ways to fund it, other ways to support each other, other ways to work better with the primary healthcare network, but also other partners like industry, because it's actually not a health problem on its own. We just deal with the consequence of it.
Have you worked out what the economic benefit is for every dollar you spend on a system like this, how much you save down the line?
From a diabetes perspective,
Yeah.
Glen would be able to answer that one better. I know that we spend about $18 billion a year, and we know that our patients spend twice as long as a hospital with diabetes than they do without. So the problem is big and it's expensive.
Diabetes Australia is patient-focused, but it hasn't been prominent in this area, or maybe I've just got the wrong idea here in terms of Diabetes Australia, where you're focused on so many different issues. Are you really focused in the future on the sort of community-based, multi-sectoral, socio-economic, really what I'm saying is the upstream issues to do with diabetes?
I was actually reflecting on something that Matthew said before, which connected earlier. I actually spent my first 4 years in Seven Hills, and so this is sort of for me thinking about the past leading to the future. First 4 years in Seven Hills, chronic heart disease and respiratory conditions in my family, not myself thankfully. So my parents' GP said, move, go to the Blue Mountains. They did. White, lower middle class, they've got family in the Blue Mountains. We moved to the Blue Mountains, fresh air, trees, active, engaging. At the same time, my wife across the M4, Fairfield was their safe haven from where her family had moved from overseas. There was no conversation about the move. Fast forward to today, my father doesn't have diabetes, my father-in-law has type 2 diabetes. So when I think about in terms of the community aspects, I think about privilege, I think about prevention, I think about equity. When I think about prevention, I think about the initiative with Western Sydney Diabetes and 18% of people through the screening initiative having diabetes, 30% with pre-diabetes in this community, Blacktown Hospital, Mount Druitt Hospital. I think about equity of access to food. We've talked a lot about equity of access to food, food safety, environment, walking out the street and feeling comfortable to go down the road. You know, your children are down the street and they're safe and comfortable and active. Equity of access to technology. Obviously with, and thank you for Dr. Mike Freelander and the work as chair of the inquiry, the advocacy for access to CGM. People with type 1 have subsidised access to CGM, but there are a lot of people that are on insulin that aren't living with type 1. There are a lot of people that aren't on insulin that also need access.
Well, what's the role of Diabetes Australia in this? It's a big organisation with quite a lot of money. So
for our piece, and this is actually a really exciting month, it's started off with the inquiry. It's in the middle of National Diabetes Week and ending with tonight, in my opinion, is an ask of $200 million over the next 4 years for equitable access to technology above and beyond the amazing effort and commitment that the federal government have already made. So for us, it would make a huge difference to communities that cannot afford something as, and I'm actually at the 14th day of my CGM right now, which is privileged to have access to that. A lot of people do not have access to that. And so our ask is $200 million over the next 4 years for equitable access for priority communities, people under 21, Aboriginal and Torres Strait Islanders, and people on healthcare cards as well.
Shem, some people say, why don't we just put Ozempic in the drinking water here? And I've actually heard people arguing that we can go through all this agony. I mean, I know that this is not your aim in Novo Nordisk in terms of your involvement here, but it's the elephant in the room. And I've sat in rooms where people say, at $130 a month, it could solve a lot of the problems, rather than going through all this agony. Why aren't the GLP-1 agonists the answer here?
Great question. Thank you so much. Well, the company that I work for is basically has expertise on treatment, but treatment is not the only solution to diabetes. Yes, it's important, and we need to continue investing in research and innovation to create better medicines like GLP-1 analogs and Ozenc and so on. But we also believe in the prevention, and diabetes can be prevented. And Western Sydney is a hotspot in Australia when it comes to diabetes. The reason we are here in this collaboration is because we believe that diabetes can only be tackled through collaboration, through a united approach. And Professor Maberly really showed that under the right leadership, when community partners, local government, industry comes together, put their resources and knowledge together, that has actually specific and positive change can be made.
So you've got a global program in the Novo Nordisk Foundation.
Indeed.
About cities changing the situation with diabetes.
Cities Changing Diabetes is a global program. We have more than 40 cities in the world. And Western Sydney is the only Australian example. And it's a truly globally recognized success story. We of course would like to expand and scale our work here, as well as looking for what we can do other places.
On the basis of data, which is the city that's doing best out of your 40 cities that are doing this?
Every city is different. Like we are discussing about, every neighborhood, every local district is different. I can't comment on the other cities' success stories, but I can tell you we have a real working example here. It's a global benchmark, and our organization is fully committed to further expand that.
And generously funding it as well. But from where you sit and look across, what are the elements of success that need to be built upon for the future?
To me, for us, first of all, community-based solutions and building a place-based approach with different partners, looking at, of course, early detection, holistic education through the system, as well as, of course, looking at the overall early and lifestyle interventions that we have just talked about 3 lines and the food security. But it goes beyond that. We just need to bring more people on board, and we need to just expand and scale up what happens in Western Sydney, hopefully to other parts of Australia.
Di, you followed this journey even longer than 10 years. What do you think needs to happen next? What are the building blocks of the next part of the foundation? A microphone that works would be key, yeah.
Look, in a sense, I actually think it's back to the future. I look at what Glen has led. I look at what the partnership over the last 10 years has done. What they have done is implement a massive raft of strategies totally based on the evidence. Everything from early intervention through to prevention, through to management of chronic illness, through to community activation, you name it. The diabetes Western Sydney has been there and proved that it works and shown the evidence. What is changing now is the fact that finally policy frameworks at Commonwealth and state level are catching up. So they're starting to reflect the evidence. Things like the National Health Reform Agreement, like strengthening Medicare, like My Medicare, which will see people join with a local GP, will give the federal government the means to invest into general practice, quality, equity, access and outcomes. None of that has been in place before. So when you hear people like Ken Singh talking about what he's doing in his practice, it's actually cost him money to do that. No one's paid him to do that. He has pioneered ways in which he not just manages the practice population in a proactive way, empowers his own practice population, but works with the PHN to actually build health and sustainability in Western Sydney. So I think that the groundwork's finally paying dividends in terms of national policy framework. We're finally seeing the Commonwealth and state come together and say to PHNs and LHDs, you need to get your act together in terms of joint governance. We'd like to know what your joint governance arrangements are and tell us by the end of this month, please. Well, that is a brilliant outcome. So there's every chance that we can go on from here. The problem, and it is a major problem, is have they got the bravery to invest as fast and as deeply as needs to happen? You mentioned earlier on about general practice. Instead of having 40% of our medical graduates going into general practice, we're down to about 15% or less. That is a disastrous state of affairs, and primary health care in general is in much the same boat. So whilst the policy framework is ending up in the right direction, it is going to take far more in the way of dollars invested carefully to reward the right things, quality, equity, outcomes, and in a hurry if we're going to reverse what is otherwise going to massively undermine the whole system.
And Andrew, PHNs have a key role in facilitating this and enabling it. What enablers do you think should be promoted moving forward?
I think from a Western Sydney PHN and WentWest perspective, it's going to be continuing with the research, the data analysis, but I think it's going to be lobbying and taking a joined up approach. And I just wanted to make some observations from the discussions tonight, and that's been, we've talked a lot about, heard a lot about the health budget topping $30 billion. It's not only health's responsibility. We really need to think about the other portfolios such as sports and transport coming on board with this. I got off the train coming here this evening and came up the stairs at Blacktown Station. The first thing I was greeted with was a McDonald's. Next door to that is a tobacconist selling all the rubbish that it sells. Then coming up Main Street past about 6 convenience stores selling lots of things. Now I'm 9 months into my experience with type 2 diabetes, and I nearly came off the wagon on the way up tonight. And then get out in the door here, and there's the bus shelter, which the lifestyle group are really pushing the 2 kilogram challenge. That needs to be at the platform of the train station when people are getting off the train, not at the end of that trip. And it's thinking about how can the PHN advocate for those sorts of things across different levels of government. And just to pick up one of the points that Jasmin said, it's not just the ABF funding that is a state issue, it's what the state government in health think is important and what is not. And so these guys are under immense pressure for ambulance ramping, ED performance, surgical waiting lists. Jasmin doesn't get a call to say how many patients with diabetes have you treated today, so it's really thinking about...
There's no waiting list for diabetes prevention.
Exactly. It's not publicly available. BHI could really think about looking at the measures that are really going to make a difference there. And because the PHN is outside of that loop, we could potentially use our role to advocate and lobby for changing those measures.
Thank you very much. Glen, I'm going to depart from the planned programme. I think you should come up here and talk about your vision for where it comes to and putting it together. And I believe that there's a musical interlude to end as well. So thank you all to your panel. If you just stay there for the moment, and I will, Glen, to close.